That's why we see about this stress incontinence more in detail. Okay, so even though if we have a smaller role in urge incontinence or functional incontinence, but our major role will be on the stress incontinence. And not only that, major of them are affected with this stress incontinence. Especially women's will be affected with the stress incontinence. So what is stress incontinence means? So in case if they have a leakage, maybe a drop or maybe a hole of the urine is leaked out during coughing or sneezing, then we call it as stress incontinence. That means because of the stress or pressure over the abdomen, if they have any, because of the stress or pressure over the abdomen, if they get this leakage, then it is called as stress incontinence. Okay, so I can explain with this picture. You can see here. So, in normal situation, in case if there is any pressure in the abdomen, that is called as intra-abdominal pressure. So, this intra-abdominal pressure can be due to coughing, sneezing, sometimes due to laughing. During all these times, what will happen? The diaphragm will be pushed downwards. So, when the diaphragm is pushed downwards, then the pelvic, all the organs will be compressed in the pelvic cavity. Okay, so during that pressure, the pelvic floor muscles will contract automatically and hold the openings, and it will prevent any kind of leakage, maybe feces or urine or maybe any discharge from the vagina. So all the openings will be closed tightly with the help of the pelvic floor muscles. So there is no leakage in through any of the opening. Is that clear? So this is common for men and women. But if the pelvic floor muscles are not stronger, if the pelvic floor muscle is not able to hold the opening, then it leads to some leakage. Okay, so that is called as incontinence. So if there is a leakage in the fecus, it is called as fecal incontinence. If there is leakage in the urine, then it is called as urinary stress incontinence, incontinence. Is that clear? Okay. So what is the what is the here mainly we see that the muscle is getting weaker. So what are the factors that is leading to weakness of this particular muscle? Okay, just a minute. So there should be some reason for this particular muscle getting weaker. So once we prevent those things or those factors, once we control those factors, then automatically we will be able to control this particular incontinence. So first thing is pregnancy. So due to pregnancy and due to the hormonal changes, this particular muscle will undergo a lot of stress. One is like there will be, because of the hormonal changes, the muscle will become little loose. Not only this muscle, all the muscle will become little weaker. Then especially this muscle will be getting affected because along with the abdomen, the pelvic, the uterus and the baby will become heavier and heavier. The whole pressure or the whole weight will be over this particular muscle, which will lead to weakness of this particular muscle. Okay, so the muscle will become little strained due to the pregnancy. Okay, so this is first reason. Another reason is childbirth, especially during normal delivery. So during normal delivery, what will happen? The baby will be coming out through the birth canal. Uh, so uh, so once like uh, once the baby is coming out, the baby will be just pushing the muscle, and it will it will be straining the muscle. Okay, so this will lead to weakness of this particular muscle, or you can say like this will be straining the muscle. uh, Then another thing is aging. So aging is like other normal natural process of aging. This aging will be affecting the pelvic floor muscle. So the pelvic floor muscle is like a sling and it will be holding the complete structure. So as the time is going on, the sling will be getting little looser. Okay, so that is the normal aging. It is there in all the muscle, and it will be little more in the pelvic floor muscle because of the position of the muscle. Okay, then another thing is uh, another thing is menopause. So menopause, especially in the women. So menopause is like that is the end stage of the women's fertile life, and during this time, the hormones will change. Actually, the hormones is like a protective thing, protector of the women. So once the protector is removed, then automatically they will have this. There is more chance of these kind of problem. Okay, so that's why like menopause also will be leading to this weakness of the muscle. Then long term participation is high in high impact activities. High impact activities like lifting heavy weight, coughing, sneezing. Not only that, like when you are taking up bending a lot of time, when you are doing gymnasium, when you're doing any long jump, high jump, or any high impact activity, if you're doing for a very long time, that will be definitely affecting this muscle, because once you are jumping, or you can just say when you are lifting heavy weight, it will be straining, you will be straining your abdomen. So once you strain the abdomen, automatically the pressure will go to this particular muscle. Okay, then hormonal deficiency. So hormonal deficiency may be because of PCOS or any other hormonal problem. This will lead to weakness of this pelvic floor muscle. Then constipation. So constipation, if you see continuously, if you are straining to pass motion, you will be affecting the muscle. So these are some of the factors that will be leading to weakness of this particular muscle. So in this factors, if you see, major of the things are will be there in a women compared to men. That's why women is more affected by the stress incontinence compared to men. Okay, so the other risk factors are, just a minute. I'm so sorry, students. Like when I get call from office, I will not be able to I have to talk to them. That's why. Okay, I'm sorry. So here, first thing is like we have seen what are the factors that is leading to the weakness of this particular muscle, and most of the factors are related to women's. Okay, so that's why women's are getting more problem, more there is more prevalence over this particular disease. Another thing is like what is the risk factor? So first is gender. So as I said early, men are lesser affected compared to female because of the some of the factors like pregnancy, hormones and hormonal imbalance and other thing. Then second is age. So this is very common in older age because of the normal aging process itself. Then third risk factor is obesity. So if the women, if the men or women, if they are obese, then they have more chance for the stress incontinence. Because most of the time, if you see this in a obese person, if you see the body, there is a trunk will be more having more weight. So the complete weight of the trunk will be putting pressure on the pelvic floor muscle because that is a sling. So that pressure will give continuous strain and stress over to the muscle, and that will lead to weakness of the pelvic floor muscle. Okay, the next is smoking. Why smoking means if the person is smoking, definitely they will have coughing. So due to coughing, the diaphragm will be pushing the pelvic floor muscle, and that will be causing that will be getting strained, and that will lead to weakness of the pelvic floor muscle. Then any other medical disease. So medical disease may be a person is having thyroid, or the person having TB, or if the person is having any other problem that is leading to increase in the intra-abdominal pressure, and that will lead to a risk factor for this particular problem, because maybe a tumor in the stomach or tumor in the pelvic cavity or tumor in the pelvic organ anywhere, so that will be giving extra pressure to the pelvic floor muscle, so that will lead to weakness of the pelvic floor muscle. Okay, so we need to think of two things. One is because we need to avoid this problem, and we can easily avoid this problem. So to avoid this problem, we need to concentrate on the risk factors. So these are the risk factors. So for all these risk factor people, if you start giving exercises, then automatically you will be able to prevent this particular problem. Is that clear? Then next is like we need to differentiate whether the person is having incontinence because of the pelvic floor muscle weakness or having some other issue. So that is called differential diagnosis. So here we need to differentiate with the urinary tract infection, because people having urinary tract infection will cause similar problem stress incontinence. Okay, so you need to ask the person to go, or you can refer the person to a general practitioner or a general doctor or a gynecologist. So let them go and check whether they have any urinary tract infection or problem. Okay, so if they have urinary tract infection, then they have to take medicines or antibiotics or anything, and they will be they have to reduce the infection. Then once the infection is reduced, automatically the incontinence symptoms also will get reduced. So that is a differential diagnosis. Then next, so what is like when we say incontinence? So there should be some grading for this incontinence, isn't it? So this test urinary incontinence is graded with this 4 grade. There is grade 0, grade 1, 2 and 3. Grade 0 is incontinence without leakage. So they may have incontinence kind of symptom, but they will not have any leakage. That means by the time the urine is coming out, the person will be alert enough to hold the urinary leakage, or the person will be able to stop the urinary leakage. So that is called grade 0. Grade 1 is they may have incontinence only with severe stress, or if the intra-abdominal pressure is very high, then only they will have this incontinence problem. So that is called as grade 1. Grade 2 is with moderate stress. So even if they are going up, walking fastly or climbing up and down the stairs, they will get this incontinence problem. Then grade 3 is if they have very lesser stress itself, they will get incontinence. Okay, so that means grade 0ers, they will have incontinence kind of problem, but they will not have any leakage. So by the time they have leakage, they will be able to hold the urine. Okay, the grade 1ers, if they will be having incontinence problem only when they have a very severe stress and strain. Other than that, they will not get the incontinence. Then moderate stress, third is with mild stress. So with this, you will be able to grade the stress urinary incontinence. Next is how to check this muscle grading. So muscle grading, this is Oxford scale, but for pelvic floor muscle, normally use a different scale. I will be explaining another scale when I'm talking about the assessment. So this is normal Oxford grading where 0 is no muscle activity, 1 is mild flickering muscle activity, 2 is weak muscle activity without circular contraction, moderate muscle activity with circular contraction, then good muscle contraction, then strong muscle contraction. So we have just now saw the causes of incontinence. So that same causes only is explained again. So next is assessment. So assessment, we have subjective assessment and objective assessment. As any other problem in the women, this incontinence also we will not be able to do many of objective assessment. Many of the things you have to get the details from subjective assessment. So first is demographic data, then we will be getting the history. So in the history you have to get the history of present condition, that is like presently how the condition started, whether it was all of a sudden or slowly they got this particular problem during like when what activity is increasing the problem, and what are the things they are able to do to prevent this particular problem. So all those things you have to get from the present history. Then gynecological, you need to check for abnormal hormonal imbalance or abnormal hormonal cycle, hormonal imbalance, or whether they have any PCOS or any other hormonal related problem. Then obstructive history, you need to get G, P, A and L. G is gravida, that is number of pregnancy. P is parity, number of delivery. A is abortion, number of abortion. L is number of live children they have. So this details you have to get under the obstructive history. So in case if they have any children, then you have to check whether it is normal delivery or cesarean delivery, because normal delivery will be affecting more compared to cesarean section. Is that clear? Okay. Then next is medical problem. So medical problem like thyroid or any other things, that will be coming under medical problem. Then or diabetes, coughing, TB or cancer or any other things they have. So that will be coming under medical problem, and what are the medications they are taking for that particular medical problem. The next is surgical. So if they have undergone any surgery, then the muscle will undergo weakness. At least the muscle power will reduce to 1 power. That means before the surgery, if they have muscle power 4, then after surgery, definitely it will reduce to muscle power 3. So at least to a 1 grade it will reduce. So you need to check whether they have undergone any abdominal surgery or vaginal surgery. Okay, any other vaginal surgery also will lead to weakness of this particular muscle or straining of this particular muscle. Then next is type of incontinence, then frequency of leakage. So how frequently the women or men is having the leakage. So that is called as frequency of leakage. Okay. Then in this frequency of leakage, so you can just in this frequency of leakage, so normally we can get this using the 24-hour chart or a weekly chart. So that means they will be having something called frequency chart. So this frequency chart will be like there will be a column and rows, and you will be having it will be a hourly based one. So 6 o'clock, 7 o'clock, 8 o'clock, 9 o'clock, like that. So between the 6 to 7, how much fluid you took and how much fluid you have voided out, and whether you had any incontinence or not. Okay, so if you have incontinence, whether it is few drops or few ml, or how much you have leaked, so that details you have to write in the chart. And this can be a 24 hours chart, or can be a weekly chart, or even a monthly chart. So this will help the doctors or a physiotherapist to find out what is the severity of leakage. Okay, then next is whether they have any voiding symptoms. So while voiding, what are the symptoms they have? And whether they feel something is coming out, whether they feel as if something is there inside. After voiding also, whether they feel something is still remaining. So all those things are called as voiding symptoms. So you need to check for that. Then you have something called severity of leakage. Then you have to check for quality of life scoring. Okay, so severity of leakage, then you need to check for the quality of life scoring. So this will be coming under the objective assessment. Then the subjective assessment where you need to perform certain things, and you have to, so you have to perform some activity and find out what is the outcome of that. So the first thing is dermatome checking. So I think you would have already known this dermatome checking, you would have learnt in your neuro. So the dermatome and the myotome checking. So dermatome is like, you can either check from C1, or you can also check, yeah, you need to check from the C1. Okay, so that is your dermatome checking. Then next is myotome. So again, myotome is your reflex checking. So that also you can check from C1 till S1. Then abdominal examination. So abdominal examination, you have to check whether you have to palpate the abdomen and see for any bulging or any tumor kind of thing, or any other abnormality in the abdomen. Like we have 9 quadrants, so we need to palpate all the 9 quadrant, and we need to check whether there is any abnormality in that particular session. Okay, then next is digital examination. So digital examination is like, you need to find out whether they have any, what are the symptoms they have during the coughing, and you can observe the area, all those things. So that is your digital examination that we will be seeing in detail. Then pelvic floor muscle grading, then frequency volume chart, PAT test. So not only that, we have many more tests. All these are some examination to check whether you have severe, to check what is the severity of the problem. Okay, so all these tests will tell you what are the severity of the problem. Is that clear? So let me explain all these tests in detail. Are you able to see the screen? Are you able to see the screen?
Yes, ma'am.
So here, like in voiding symptoms, if you see, whenever they are urinating, whether they feel any hesitancy, or whether the urine is flowing very slow or intermittent, whether they have any gap between the urination, or whether they feel complete emptiness, or whether they feel some incompleteness, all those things will come in voiding symptom. Okay, severity of leak, you need to say whether no leakage, little leakage, moderate leakage, or large amount. And QL is quality of life score. That is a questionnaire which we will be usually checking to using to check the quality of life questionnaire. So first is like digital examination. Okay, so digital examination, you need to position the patient in crook lying. Okay, so you need to position the patient in crook lying with hips abducted and feet apart. Okay, and being a therapist, you have to sit at the leg end of the couch. So sit at the leg end of the couch and you can observe the area. Okay, so when you are observing the area, you need to wear a waterproof underpad. You need to wear gloves. You need to cover the patient with a sheet, and you can just observe the perineal part alone. Okay, so and you have to wash your hands before and after checking. So first thing what you have to do is in digital examination, you need to observe the perineum. So observe the perineum for any scar or any skin condition. So for any scar means like so they will be checking uh, is there any wound or anything that is there or any infection or anything is there, and because of the infection they have some scar over the perineal part. Okay, that one you have to check. Then what is the skin condition? So normally the patient who are having incontinence, because of the urinary leakage and because they are remaining with the wet underpad for long time, they will be having some kind of different kind of skin condition. So it is called as excoriated skin. That means the skin will be like a puckering one. Okay, so it will be like tethered kind of skin. So you can see if you are keeping your hand inside water for a long time, then taking out you will be seeing some kind of a different texture. Same thing, same kind of structure will be there in that particular men or women over the perineum. So this is because the area is in wet for very longer time. So then you have to check whether there is any infection or discharge. Okay, then after that, so this is your observation. Then after that, you ask the person to tighten the muscle. Okay, so when they are tighten the muscle will undergo a circular motion like drawing in and around the coitus. Okay, so this one you can just see the hole will be closed. So whenever they are tighten the muscle, the hole will be automatically closed. So you have to observe for that whether they have the movement or not. So most of the people, if they have incontinence, they may not be able to have this, but like they will be at least like you will be knowing whether you will they are able to close or shrink the hole or not. Okay, then next is regarding the sensation, whether they have any pain or discomfort or like what kind of sensation they are able to feel around the perineum. So this one you can check. So that is for your sensory checking. Then you can also check for pain and other things. So sensation checking is same like your other body. You will be doing the sensation check on either side. Then, after this, you have to ask the person to cough. So, while coughing, you observe for the aerial change. So, you can just see what are the different shapes and what are the different way the particular muscle is moving when the person is coughing. So that is called as observe for the coughing effect. So sometimes the part will be closing, sometimes the part will be bulging out, sometimes the part will be descending down. So this is the effect of coughing. Okay. Then next is like you need to check what is the muscle grading of or what is the grading of anterior wall of vagina and the posterior wall of vagina, whether there is any changes or any other difference or anything. Then what you can do is you ask the person to gently squeeze the anal area and see whether there is any skin tag or hemorrhoids or any other puckering. Okay, ask them to do that. Then just separate the labia gently and slide the palmar surface of the fingers along with the posterior vaginal wall uh, to full length and check whether there is any rectocele. Okay, so that means you can just separate the labia and see whenever the person is coughing, whether you find whether you find any uh, descending down of the pelvic organs, like maybe a rectocele or a cystocele or any other thing. Okay, while you are doing this, watch the patient's face or for any discomfort or pain. So while you are doing that, you just observe the patient's face and see whether there is any discomfort over the particular area. Okay, so this you have to see. Then next is like what you have to do is you press posteriorly and ask the person to do a contraction. See whether the opening is closing or not. Okay, so we know the pelvic floor muscle has different because the pelvic floor muscle is made up of three different types of muscle. So you have to palpate on the posterior, anterior wall and the medial wall and see what is the difference. Whether the to find out exactly which part of the muscle is weak. So you can palpate and look for the changes. But all those things, if the patient is allowing you, then you will be able to do this. This is the digital examination. Then comes your muscle checking. So at the end of the digital examination itself, you will be going into the muscle checking. That is, you will be palpating the posterior wall or anterior wall or on the lateral wall and see what is the how much the person is able to contract or close. Okay, that one you can observe. So while observing, we can use Oxford scale, but more than that, normally this pelvic floor muscle is checked using this perfect score. Okay, so this perfect score was formed by Laycock and Jerwood. So they formed it in 2001. Okay, so this perfect score where it is graded with 0, 1, 3, 1, 2, 3, 4 and 5. Same like our Oxford. Apart from that, you will be checking another thing. That is P means power. So power is nothing but you will be giving them the score 0, 1, 2, 3, 4, 5. Okay, so that is called as power. Okay, then E for endurance. So in the perfect, P is for power. So which you can use this Oxford scale and check what is the power. Okay, E is for endurance. Endurance means how long the person is able to hold the contraction. Whether the person is able to hold for more than 5 seconds, 3 seconds or 8 seconds or 10 seconds. That only you have to check. So that is called as endurance. The next is repetition. Some people will be able to do, okay, but if you ask the person to do a repeated movement, then you will not be able to do it, or then they will not be having that same kind of contraction. So that is called as repetition. The next is like fast. That is, if you are asking the person to contract and relax immediately, whether he is able to do it or not. That is called as how fast you are able to do it. Okay, then so you contract uh, for 1 second, then relax, then contract and hold it for 10 seconds. So if you do this contraction and relaxation for more than 10 times, whether the person is having any fatigue or not. So that is called as fast here. Next is elevation. Okay, and C for co-contraction. What is the other muscles? So that is called as co-contraction. Then T for timer. Okay, so all these together is called as perfect score. Okay, so you need to perform all those things and then you have to come to a conclusion. What is the score? And we will be getting a perfect score. Okay, so this scale is called as perfect score. Then, so from lying down slowly, you can also do the testing in standing and sitting also. Okay, so the testing can be done in standing and sitting also. Next is frequency volume chart. So that one I already explained you. You will be having rows and columns. So where the rows will tell you what is the time and okay. Let me just check whether it is there. Okay, so I don't have that. So it is nothing but there will be columns and rows where they will be writing the time. There is 6 o'clock, 7 o'clock, 8 o'clock like that. And according to the timing, if you void, you have to write voided. If you are able to measure how many ml, then you can measure and write. Then if there is any leakage, then you have to write it there one. So then you have to write it whether the leakage was very little or that is like drops or little or more. Okay, so this one the patient will be writing in the house and they will be bringing to you. So that then you will be able to decide what type of problem the particular, how severe the problem the particular person is having. Next is PAT test. So I think we will have a break here for 5 minutes. Don't log out. You can just drink water or stretch yourself and come back.
Okay, miss.
Can we start? So after this digital examination, so in digital examination at the end again you will be continuing with the muscle power testing. So after but sometimes some of the women may not like to perform this particular test. So then you can go with the other test and approximately find out how severe the problem is. Okay, so for that only we have the other tests, other things. Like first thing is the pad test. So here what you will do is this pad test is done for 1 hour or it is also done for 1 day. Okay, but most of the time this one we will be doing for 1 hour. So what we will do is we will be asking the women or men to wear this pre-weighted observable pad. Okay, so it is same like our sanitary pad. So we will weight the pad and we will see how much is the weight. Then we will ask them to wear this pad. Okay, so while wearing, for the first half an hour, we will be asking them to drink around 500 ml of sodium-free liquid. Why sodium-free liquid means if they are drinking sodium liquid with sodium, then it will lead to water absorption. Salt will lead to water absorption. So that's why we need to go with distilled water or plain water without any sodium. Okay, we will ask them to drink this sodium free liquid. Okay, so after drinking this 500 ml, for the first 15 minutes we will give them rest, or even for the first half an hour we will ask them to take rest in sense just sitting. Then after half an hour, you ask the person to walk around the area, climb up the stairs, climb down the stairs and perform some exercise like bending down exercise, lifting the leg exercise, all those things. Okay, so first half an hour we will give them rest. Second half an hour we will ask them to do lot of activities like walking around, climbing down, bending down, sitting and standing, jumping, all activities like that. Then running, bending down, picking up an object, lifting weight. Then ask them to cough vigorously for 5 times or 10 times like that. Then ask them to hand wash under cold running water. Usually when you open the pipe because of the water because of the sound where the bladder will be stimulated and it will tend to void. That's why we are doing the activities whichever to stimulate the dextrous muscle. Okay, so ask the person to wash the hand under cold water for 1 minute. Like that we will be giving them lot of activities that will be increasing the intra-abdominal pressure as well as that will be stimulating the dextrous muscle activity. Then after this 1 hour, then we remove the pad and we will weight the pad. Again we will weigh the pad. So then we will see what is the difference. That is before the 1 hour when they are wearing, what is the weight. Then after this 1 hour, what is the weight. Then according to the weight, we will decide how severe the problem is. So normally they will be having 1 gram increase is considered normal because most of the women will be having some vaginal discharge. So 1 gram will be considered normal. Same like that, 8 gram will be considered normal for 24-hour pad test. And same like that, 15 grams will be normal for 48 hours pad test. Then after this, like more than this 1 gram, 1 to 5 grams will consider as mild, 5 to 8 will be considered as moderate, and more than 8 grams will be considered as severe incontinence. Okay, so this is the pad test. Okay, 1 minute. So at the end of the 1 hour, so we will wait and we will see if it is like 1 to 5, then it is mild. 5 to 8 will be moderate, and more than 8 grams will be severe. So like that, normally they do for 24 hours and they also do for 48 hours. Why? Because some people will have very less incontinence. Maybe they may get incontinence only once in a day, or they may get incontinence in two days once. So for those people, they will go for this 24 hours and 48 hours, but it will be little bit difficult for doing those things. Okay, next is paper towel test, but this paper towel test usually presently we don't do because it is having some it is not that much dignified test. So that's why we don't do. So what we do was we give them a colored paper towel, that is like nothing but tissue. That tissue will change its color according to the urine. Okay, so once the tissue has some urinary leakage, then it will change its color. Okay, so what you do is you ask the person to hold this tissue against the perineum and cough 3 times. Okay, so not in the open place inside the bathroom. You ask them go there inside and cough 3 times with a paper towel against the perineum. So once they remove, if there is any color change, according to the severity of the color change, we see how much is the leakage. Okay, but since many people will not prefer this, normally we don't do this kind of test. Next is sperinometer. Again, this is like we will be inserting this particular machine inside, then we will check the pressure change. Okay, so one is sperinometer. So this is a sperinometer. Okay. So this sperinometer, normally it is used for examination as well as giving training to the muscle. So what you do is you insert this particular part. You can see a bulb kind of structure. It is like our sphygmomanometer one, same like that. We will be putting a glove over putting a condom over this, then apply a gel and insert this particular part inside the vagina. Then ask the person to contract. So while contracting, there will be a graphic or digital representation over the display system. So this will tell you what is the power of the, how much strong the muscle is or muscle contraction is. Okay, so you can use the same thing as a visual biofeedback and you can ask the person to do the exercise. Okay, so this is called as sperinometer. So if we don't have this sperinometer, we can also use the sphygmomanometer as a modified one. So you can see sphygmomanometer is nothing but the pressure gadget. So you can apply a condom over the particular over the piece over the bulb which we will be using to give the pressure, right? So over that you apply a condom and apply the gel, then insert that inside the vagina and ask the person to contract. So according to the pressure, you will be seeing the deflection in the mercury. So if the deflection is very high, then the power is good. If the deflection is very less, then the power is less. Then you can also measure the endurance. So if they are able to hold the contraction for longer, how many minutes, seconds they are able to hold the contraction. That one you can check to find out the endurance of the muscle. Okay. Then next is midstream stop test. Here this is to find out what is the ability of the person to contract the muscle and stop the flow. So in between their urination, you ask the person to contract the muscle and stop the urination. If they are able to only slow down the flow, then it is the muscle is weak. If they're able to stop the urine, then the muscle is good. Okay, so whether they are able to slow down or whether they are able to only hold and stop, hold and what to say, hold and if they are able to contract moderately, they will be able to slow down and only drops of urine will be flowing out. Okay, so this is called as midstream stop test. The next is biofeedback. So same like your perennial you will be getting the deflection. Okay. Next is severity index. So here we will be asking them two questions. One is how often. Okay, so here we have two questions. We will be asking these two questions to the patient. How often do you experience a leakage and how much urine do you lose each time? So according to the answer, we will be able to find out the severity of the leakage. So here, how often do you experience a leakage? In case if they are saying one, that is less than once in a month. Okay, how much urine do you lose each time? If they say 1 drops, okay, then we need to multiply the score of first and second, that is 1 into 1, then it will be 1. So in that case your severity is slight. Okay. So in case when you ask a person, if they say 4 every day or night, if they say 4, and for the second question if they say 2, then you need to multiply 4 into 2, that will be 8. So 8 is very severe. So according to the scoring, you will be deciding how severe the problem is. So these are the examination. These are the examination we will be doing to find out the severity of leakage. So according to the severity of leakage, you can go for other, you will be going for the treatment. Okay, apart from that, you can go undergo a ultrasound scanning of the bladder to find out whether they have any tumor or block or anything. You can also undergo cystometry. Cystometry is find out the bladder problem. Then uroflowmetry is also to find out the problem in the bladder. So this two, normally it is done by other technicians. So we, as a physiotherapist, we will not be doing this three. Sorry, not only three, this four we will not be able to do. So this is like you can give reference and they can go out and do for ultrasound, cystometry, uroflowmetry and electromyography. So this first will tell you whether there is any muscular problem like tumor or any block or any cyst or any stone or anything in the bladder. This too will tell you about the flow of the urine. So what is the flow of the urine, if there is any blockage in the pathway. And the last will tell you if there is any neurological problem with the urinary system. Is that clear? So this for the outside doctors will be doing it. So this is about the assessment. The next is the treatment. So the treatment first is pelvic floor muscle exercises. Then you can also give electrical stimulation according to the muscle power. If the muscle power is very less, then you can give electrical stimulation. Then for doing pelvic floor muscle exercises, you have something called biofeedback. Then we have vaginal cones, pereniometer. All these are tools or equipments that are helping you to do the pelvic floor muscle exercises. Why you want to go for tools means sometimes you will not be able to sometimes you will not be able to um, sometimes you will not be able to perform, or you will not be able to identify whether you are doing it correctly or not. Okay, so for that only we are using this particular tools. Okay, so we will see the treatment in detail. So first is pelvic floor muscle exercises. So in pelvic floor muscle exercises, we have to see certain things. One is we need to identify the correct muscle. If we are not able to identify the correct muscle, then we will not be able to do the exercises correctly. Because since this muscle is present deep inside, you will not be able to exactly see whether they are doing the exercises or not. If you want to do check whether they are doing the exercises correctly, then you need to insert your finger inside the vagina, which many of them will not allow you. So that's why you need to teach the people or a patient to find out what is the exact correct muscle. That is called as identifying the correct muscle. Okay. Then identify the correct position of the person for the patient. So normally the patient will be doing in lying down in case if the muscle power is very less. So if you feel the muscle power is only 2 or 2 to 3, then less than 3, then they are supposed to do the exercises in lying. Because in lying only the muscle will be in counterbalancing gravity position. Then slowly they can go for sitting, then slowly they can go for standing as the muscle power improves. Okay, so that is about the correct position. Then how much repetition they are supposed to do, what are the things they are supposed to avoid. Okay, so first is to identify the correct muscle. So you can also try, most of you will be sitting in a chair. Okay, so when you are sitting in a chair, you broaden your knees, that is you open up your knees and you try to sit at the edge of the chair. Okay, so try to open up the knees, that is, you make your knees away from each other. Then you sit at the edge of the chair. So, when you are sitting at the edge of the chair, there is a muscle part that will be touching the chair. So, can you feel that? So, when you are sitting at the edge of the table with the feet apart or with the knees apart, you can feel a particular muscle will be touching the chair. So you can just try to open and close the particular muscle, or you just try to do as if you're stopping the urine. So you can see the particular muscle will be moving or particular muscle will just close up and open up. So that is the correct muscle. Is that clear? So you have to make the person to sit at the edge of the couch and ask them to keep the feet apart. Then you have to just ask them, tell them that the muscle that is touching the chair is the pelvic floor muscle. Okay, so to make them to understand, you ask the person to do as if they are stopping the urinary flow. So at that time they will be feeling a squeezing effect of the muscle. Okay, then so that is a pelvic floor muscle. Okay, so when they are squeezing, ask them to close even the anus and the vagina. Okay, so all three together. So if they feel, then they will be able to feel a complete squeeze and lifting up of the muscle. Okay, so when they do this, they will be able to see a complete squeezing and lifting up of the muscle. Okay, so when they are getting this particular feel, then that is the correct muscle they want to do the exercise. Okay, so that is a correct muscle you want to make them to do the exercise. Okay, so when they are doing this, they should not squeeze their legs together. They should not tighten their buttock. They should not hold their breath, or they should not pull in their tummy. Okay, so they should be doing a normal breathing and they are supposed to do the exercises. So when they do this, then that is the exact muscle they are doing it. So position, you can see this is the correct position they are supposed to do. Okay, so when they are sitting, they are supposed to sit straight. If they are standing, they are supposed to stand with the knees apart. Then if they are in quadrupone, they are supposed to be in this position. This is the correct position. Okay, so you can teach them in lying down like that. So let me show you some video to explain you how to explain to the patient. Okay, so then this exercises can be done in a fast manner and slow manner. Fast manner means you ask them to contract and relax immediately. Okay, slow means you contract, hold for 10 seconds and relax. So that is called a slow contraction. Is that clear? So fast is contract, relax, contract, relax. Slow means contract, hold for a few seconds, then relax. Then you can also do it alternatively. Alternatively means some few fast contraction and few slow contraction, and mixed contraction also you can make them to do. Okay, so most of the time the repetition is you will be asking them to minimum do at least 10 times or 5 to 10 minutes and 3 times a day. Okay, so minimum 3 times a day, and each time they are supposed to do 10 times, or if they're able to do, then they can do 5 to 10, 5 to 10 minutes. Okay, so let me show you some video.
Unfortunately, the answer and it'll just really waste your time if that's. Do you think this exercise will strengthen your pelvic floor? Unfortunately, the answer is no. While this exercise is really great for strengthening your buttock muscles, it won't strengthen your pelvic floor, and it'll just really waste your time if that's why you're doing it. Now today, I'm going to guide you step by step through Kegel exercises that won't waste your time and will strengthen your pelvic floor. This guide is suitable for you if you're a beginner starting out, or if you're a little unsure about doing your Kegels. Now today we're going to cover the best Kegels position to start with, and then we'll go through how to do your Kegels step by step. We'll take a look at how many Kegels to start with, and also how long you need to wait for results. So when you're starting out, the best position for doing your Kegels is the one that you can really feel your exercises. It's often really quite hard to feel your Kegels, so getting yourself in the right position can really help you when you're starting out. So you might like to try your exercises in any of the following positions and see which one works best for you. So you can try perhaps kneeling on all fours, lying prone on your tummy, lying on your back, on your side with a pillow between your knees, or sitting, which is the position we're going to start with today. Now let's get started with your exercises. Your pelvic floor muscles are here, between your legs, where you sit. Now looking at the same view on this model, you can see how the pelvic floor muscles wrap around the three openings in your pelvic floor. You can see them here at the front, around the urethra and the vagina, and you can also see them here circling around the anus at the back. We're going to be exercising all these muscles together now. Now, here are the 3 steps for doing your Kegel exercises correctly. I'll guide you carefully through each step, and then we'll put all the 3 steps together. I want you to start by moving forward away from the back of the chair that you're sitting on now. I'd like you to lift your chest and keep the inward curve in your lower back like this. So you're sitting tall here, your chest is lifted like this, and you have an inward curve in your lower back. Now here's the first step. Try to tighten your anus like this, as if you're stopping gas from passing. You should feel your anus tighten, but your buttocks should stay relaxed. So try that now. Try to tighten the anus, squeeze shut. But if you notice that you're moving up and down like this, you're using your buttocks, and that's not the right thing to do. Try to keep them relaxed, because that can make you actually think that you're doing the exercise when you're not. Now try again, tighten your anus and try to lift it inwards as if you're lifting it upwards towards your navel, as well as squeezing it shut. You should feel a squeezing and lifting sensation around your anus. Now relax around that area and back to resting. How did you go with that? Hopefully you could feel a tightening sensation, and this is part of your Kegel exercise. Now, step 2 can be a little tricky, so I need you to listen really carefully. I want you to tighten and squeeze the entrance to your vagina as if you're closing it shut. All right, let's try that. Try to tighten around the vagina, but also try to lift it inwards, as if there's a string drawing up from the top of your vagina up inside towards your navel. Okay, so see if you can draw that up and in, and you might feel your anus tighten and your lower belly tighten too. That's exactly what you want to happen. Now relax back down to resting. So if you're having trouble feeling this exercise, try rolling up a hand towel and sitting on it like this. This can make it much easier to feel your Kegel exercises. Now step 3, here's your final step, so stay with me, we're nearly there. This time, try to tighten, or imagine you're tightening the area in front of your vagina where your urine comes out. Imagine that you're stopping or slowing the flow of urine. Can you tighten this area? This can be a little difficult to feel, especially at first. You might also feel your anus and vagina tightening too, and if you can, that's great. Now relax back down to resting, take a nice deep breath in and out. And now let's combine all 3 steps together. This is a correct Kegel exercise. Start by sitting tall, breathe normally. Now tighten your anus and vagina and lift them both inwards and upwards inside towards your navel. Now at the same time, try to squeeze as if you're stopping the flow of urine at the front. Do these actions all together, all at the same time, and now relax back down to resting. Take a deep breath in and out. How did you go with that Kegel exercise? Could you feel your pelvic floor muscles contracting? If you're a beginner, try not to be too hard on yourself, because Kegels can be really hard to feel, especially when you're starting out. But once you can feel the muscle tightening, you'll be well on your way to strengthening your pelvic floor. Let me know below if you have any questions about how to feel these exercises. I'd really like to know. Now, how can you know if you're doing this exercise correctly when you're starting out? Well, there's a couple of ways, and these are quick, easy ways you can try at home. You can try to stop or slow the flow of urine, but just do this once a week, and just as a test, not as a regular exercise. You can also test some of these muscles by tightening to stop passing gas when you feel the urge to pass gas. The video linked above helps you to feel your Kegels, so you may like to watch that exercise too if you're still unsure about how to do your Kegel exercises technique. How many Kegels should you start out with? Well, when you're starting, start the first couple of days just doing 1 or 2 gentle Kegel exercises in a row, and really try to focus getting your technique correct. This is the most important thing you can do at first. Then, as your technique improves, you might be able to do a few more Kegels, and you might be able to hold those exercises for a little bit longer if you can. Try not to worry about doing strong exercises just yet. Technique is far more important. You may like to subscribe below to catch my Kegel strength training video that's coming up in the next few weeks. Now, if you can do 2 Kegel exercises in a row for 3 seconds, that's the number of exercises you start with. 2 exercises in a row and holding each exercise for 3 seconds. Try to repeat this routine 3 times a day. Ultimately, you're working towards doing your Kegels following this recipe. 8 to 10 exercises, up to 10 seconds for each exercise, and resting for about 6 to 10 seconds between each exercise. And you try to do that exercise routine 2 to 3 times a day on most days of the week. Now, some women will notice improvements within the first couple of weeks of starting their exercises, while other women will find it can take 5 to 6 months to actually get full strength gains, particularly if starting out with weak pelvic floor muscles. Thank you for watching today. I really hope this guide helps you get started and feel a lot more confident about doing your Kegel exercises. Now, don't forget to give this video the thumbs up below if you found it helpful, and subscribe for my upcoming Kegel strength training video. I'll see you next time. Goodbye for now.
Okay, just a minute.
What we're going to be doing is checking for.
Okay, so this is regarding assessment of the pelvic floor muscle. Okay, so but it is a very big video, so I'm not going to show you the complete one. Okay, so maybe later I will attach this in LMS and later you can have a look. Okay, so maybe
Muscle
for the
tone,
first few
whether
minutes you
it's
can
high tone
watch.
or low tone. We're going to check the muscle strength. We're also going to check for pain or reactivity of those muscles. And in order to do that, we're going to do a full assessment, as we said, externally and internally, vaginally and rectally, usually for these clients, depending on the complaints that they're coming in with. One of the teaching tools that I use is this. Basically, it's a paper diagram that was created by Marie-Josée Forget. It's great for a good reference point for us, as well as using as a teaching tool for the clients. It is not uncommon that I will actually give this to the client while I'm doing the assessment. I obviously orient them to it, and then they're holding on to it while I'm actually doing the assessment so they can follow along. It's really good for their anxiety. It keeps them occupied, and plus they get to see what we're actually doing in there. Now, for our purposes, we're going to use it today because as I'm teaching you which muscles to assess and what we're assessing, we're going to follow along with the diagram. So just to orient ourselves here, this is obviously a female diagram. We've got the vagina, the rectum, the coccyx at the bottom, the pubic ramus at the top, and then we've got the ischial spine here. The muscles that we'll be looking at mostly will be pubovaginalis, coming around here, around the vagina, puborectalis, going down like a horseshoe down through around the rectum, pubococcygeus attaching to the coccyx, is iliococcygeus, ischiococcygeuus. Even we assess piriformis, as well as obturator internus, which we are assessing quite often as well. Obturator internus, just to remind you guys, we have this other model here. It's this one. So if you look at the pelvic floor, here's these guys, the puborectalis and ischio or iliococcygeus and ischiococcygeuus, but over here, this is obturator internus. And he's the one, or that's the one that comes around with the tendon around the ischial tuberosities and attaches onto the hip bone. So it's an external rotator of the hip. If we flip this model around, you can see externally what we can also palpate. So externally on the client. So we've got ischiocavernosus, which just goes along there, along the pubic ramus, bulbocavernosus, the external anal sphincter, and superficial transverse perineus, which are coming together and converging at the perineal body. So we can use that as well. So we'll be using this while we do the examination. While I'm demonstrating on the model, we'll be going back and forth between this and this model, showing you kind of what position my fingers are in, and then most likely, you know, whether you're at the first or second or third knuckle, which muscles and what angle you're at to palpate different ones internally. So during this pelvic floor assessment, we will also be assessing pelvic floor strength. And when we do, we're going to be using the traditional scale of 0 to 5. Now we're going to move on to the external assessment of this client who's presenting with pelvic pain. We just start with a visual. So we're just going to take a look at what we see here. So the first thing that I tend to look at first is I'm just getting a general read for any trophic changes, meaning, can we see what's the color like? Is it gray? Is it pink? What's the hair look like in the area? Is it starting to thin, or is it still relatively coarse? We're also going to take a look at any signs of rash or irritation in the area. I would often just separate the labia to be able to look even between labia majora and labia minora, but even just externally you can sometimes get a sense if it's looking a little bit red, or if there's, like I said, a bit of a rash. We're also looking for signs of tone, even like the labia themselves, when the tone is still preserved and there's very little trophic changes, they'll still be quite plump, as opposed to when we have hormonal changes as we age, then those labia tend to recede back a little bit, and in all fairness can tend to look a little bit wrinkly. That would be suggestive that we're having some trophic changes there. We would also externally palpate just for sensation. So I always tell the client before I'm going to do anything, especially, we should be doing this anyways, but anybody that is suffering from pelvic pain, we don't have any idea yet of their level of sensitivity. So I just start in an area that would be non-threatening. So the buttock cheeks, I'll just say I'm going to use the back of my two fingers. I'm just going to press against the left butt cheek. When I wait for them to say yes, they're like, yeah, okay, so I'm just going to press. And I'm asking them, does that feel okay? Does that feel normal? And I'm looking to see whether they're going to say that it's very painful, or if it feels any other kind of sensations. And then I palpate on the right side, and then I'll say left labia, and I'll go up there, and then right labia. And then often I tell them as well, I'm going to check between the wind and the rain, so just between the vagina and the anus, and I'm just palpating there in the region of the perineal body, just to see what their sensation's like. Once we've done that, I will often move on to assessing just externally two reflexes. The bulbo cavernosum reflex at the clitoris, which what we do is we just gently, very gently, I will slide back the clitoral hood, and then I will just gently give it a little flick, and you'll often see it just retreat. When I'm doing that as well, what I'm actually also checking is just for the mobility of that clitoral hood. Sometimes it's tethered a little bit and won't draw back, and if that was the case, that may be due to high tone or some connective tissue adhesions there, but we don't see it very often, but we're assessing for that too when we're checking that. Then I would just ask them if it's okay if I just separate the buttock cheeks, and then I very lightly, and I tell them ahead, I'm just going to just lightly stroke on the external anal sphincter, and you just stroke it, and again you'll see it kind of recoil and draw in a bit. That's just those reflexes. So now we're going to move on to assessing the musculature that we can actually assess.
Okay, so I think that it's a very big video, so you can just watch it later, and she clearly explains how to palpate. That is, this is completely the digital examination. Okay, she is explaining you the digital examination. Is that clear? So you can check later, then if you have any doubt, then we can discuss again. So next is, so we have seen how to assess, then how to give them the pelvic floor exercises, and there are definitely certain things that you have to avoid. One is breath holding. So if you hold your breath, automatically the diaphragm will be pushed down and it will be compressing over the pelvic floor muscle. Okay, so you will not be able to do the proper pelvic floor muscle. So that's why you have to avoid this breath holding. Then bearing down instead of lifting, that is, if you just do as if you are straining for passing motion, that is called as bearing down. So if you do that also, you will not be able to do the correct exercises. Then do not activate any other muscle like abdomen, hip adductors. Okay, so don't activate those muscles. So that, like, if you do a individual muscle, then you will be having a very good result. If you are doing all other movement, then it will be affecting the particular muscle exercises. Then bad posture. So you have to choose a perfect posture. In case if you're not able to sit erect, then go for a lying down position. Okay, choose the correct position in which you will be doing, you will be able to do the exercises exactly. That is very, very important. Okay, do not try to pull in your abdomen. That is, don't do your isometric abdominal exercises along with this. Then don't do isometric adductor exercises along with these exercises. So these are the mandatory points you need to stress the patient while doing this particular exercises. Then we have certain tools that will be helping us to do the exercises. It is same like our it will be giving a visual feedback. It will be same like our dumbbells and other weight cuff things. Okay, so this is called as vaginal cones. So this will be of different shapes. So you can see bigger one, smaller one, smaller one. So initially when the muscle is weak, you need to give them the bigger one. And you need to ask, that is, you need to insert this into the vagina, then ask them to hold it. Okay, so hold the bigger one. If they are able to hold this size cone without falling down when they are walking or when they are sitting or when they are standing for more than 1 or 2 hours, then go for a smaller one. Then go for the smallest one. Is that clear? So vaginal cones are of two types. One is different shape, another one is different weight. Okay. So first is you need to, if the muscle is weak, according to that you need to use the vaginal cone, go for a bigger one. Then if they are able to hold this particular cone without falling down when they are walking or when they are standing for more than 1 or 2 hours, then go for the smaller one. Okay, so that means when you are inserting this, automatically they will be doing the pelvic floor muscle exercises and they will be holding it. If they are able to hold, then go for the smaller one and smaller one. Okay, same thing you can do with this. That is, you make the person to do the pelvic floor muscle exercises with this weight. Okay, so if you see here, there are two bulb kind of thing. You can open up this and you can put whatever weight you want to put. So go with the smallest weight. Okay, close it and insert this into the vagina and ask them to do the exercises. So you need to make them to, that is, you need to use these tools when they are when they are having a higher muscle power. That means when they have muscle power 2, you cannot use this. When they want to go for resisted exercises, then only you need to use this. That is more than 3. Okay, so then you can give this, make them to do the exercises with the weight. That means the weight will be pulling down, but the pelvic floor muscle is supposed to hold and hold the weight cuff. It is same like weight cuff. Okay, then other thing is sphenometer and biofeedback. This two already I have shown you the picture. So this two will give you more visual feedback to the patient. As the patient is able to see visually how much pressure they are giving, how much pressure they are giving using the graph or digital, then they will get more motivation and they will be able to do the exercise more and more. So this will give them a good biofeedback and they will be able to do the exercises more. So same pelvic floor exercises only you are going to do. But you are going to use some tools so that it is giving some motivation for the people or it is giving some feedback to the people so that they are able to do the exercises more and more. When the muscle power is very less, that is maybe less than 2, then you can go for this electrical stimulation. Okay, so this electrical stimulation we also have in our lab. So when you are coming back to campus, we will show you this electrical stimulation. This normally we will ask the person to buy this, or we can also may ask the person to, because like once you are inserting the electrical stimulator to a particular person, you will not be able to use for another person. So that's why we will ask them to buy this electrical stimulator and it is not very costly, maybe some 300 to 400 ringgits. Is that clear? So that is about electrical stimulation. I will show you the videos regarding the electrical stimulation. Okay, then I think we will continue in the next class. Let me show you one video, then we can continue in the next class, that is Wednesday morning. Okay.
Powered. In today's video, we are going to look at some devices used to stimulate the pelvic floor, both internally and externally. You may have seen some of the devices that are available for stimulation of the pelvic floor, or you may have been advertised for some of these devices, and you might be wondering, well, should I or shouldn't I use them? And so today I thought it would be useful just to show some of the different devices that are available and to talk a little bit about my experience with these devices. So we maybe start with the internal stimulation devices. So there are a number of devices. So I've two here. This is the NeuroTrack Continence and the Kegel8 Ultra. There's many different varieties of these devices, and they're very similar to TENS machines. What they're basically doing is creating a little electrical current that is passed down through a cable into a probe. And then that probe will create a little contraction in your muscle. So it basically gives your muscle a little electric shock to get it to contract. And depending on, there's many different types of probes that you can use. So depending on where you're going to stimulate, you'll use different devices. So this is an internal probe. It's a pretty standard probe, and you can see that it has these two silver parts. So before you use this, you would apply some sort of gel to the probe to make sure that it has enough contact when you insert it. You always insert it so that the cable is coming up towards the clitoris. So the cable always comes up the front. And then these two little probes, the little stimulation parts, are always aligned with the two side walls. So you don't ever stimulate the front wall where you have your urethra and the bladder, or the back wall where you have the rectum. You're always stimulating the sides. Now, this is another type of vaginal probe. As you can see, again, it has the two little things on the side. And again, this one you insert so that the side walls are going to be stimulated by these two little silver panels, and the wire then comes up past the clitoris. So with these two are vaginal probes. And this one is an anal probe. So the anal probe is used very often by men, because this is not just a female issue. Pelvic floor dysfunction does affect 1 in every 10 men, 1 in every 3 women. So if you're using the anal probe, there's different shapes and sizes. This one is quite small. It looks a bit scary. It's just about the size of my finger, actually, but it's not too bad. I have tried it. This one, when you put this one into the anus, you would never use the vaginal probe and the anal probe at the same time. You can only use one of these at a time. And if you want to use an anal probe, you have to use a specific program for that. Now, with all of these devices, there are programs on the devices, and you will get a little booklet with your device. And in that booklet, it will tell you what the different programs are for. And in some cases, so I'm here in Scandinavia, Scandinavian physiotherapists tend to recommend continuous stimulation, whereas physiotherapists in the UK, for example, they recommend that it's a stop-start, so it'll contract you for a few seconds and then relax for a number of seconds and then contract. So depending on which program you choose, the stimulation will be a little different. Now, it is also possible to do external stimulation with these devices. And in that case, you would get some sort of little electrodes with skin electrodes that you attach.
Now, with the Kegel 8, if you go onto the Flower Empowered, there is information there on TPTNS, which is tibial, it's tibial nerve stimulation, basically, transcutaneous tibial nerve stimulation. And this is where the electrodes are placed on the foot. So there's one placed just on the insert of the foot and one placed on the ankle, and you stimulate there, and it stimulates the nerves, and that helps with incontinence. How exactly is not quite understood. You can read a little bit more about it and the studies connecting to it from the Flower Empowered, and I'll put a little link down below to the section of the site where we go through this. But this is something that if you buy the Kegel 8 Ultra 20, there is a specific program in there for the external stimulation. Now, the electrodes, these can also be used if you want to use it like a TENS machine to release tension. It can be used for relaxation, and also you can do sacral nerve stimulation by placing the pads on your lower back. But you should always read the manual that you get with the device. There are many different programs, and you should make sure that you follow set programs. Don't try to create your own programs. Don't think, oh, well, I can put these where I want and just go for it. That, I would say, isn't very safe. So do follow the manufacturer's guidelines if you're going to do that. So that's the internal stimulation and a little bit about TPTNS. But also we have external stimulation. So let's say that you feel really uncomfortable with the idea of using an internal probe, then you may want to do external stimulation. In that case, then we have Innovo. So this is Innovo. I know that they have released these new shorts. So it's like all in one piece, a pair of shorts that you pull up and connected to a device that creates stimulation. But what I have here is the Innovo, the older version, where you would actually take these. There's one for each leg, and you open them up, and they have these electrodes, skin electrodes, and you take these pads off and you wrap them around and you attach them to your body on both sides. So they look a little bit like a pair of shorts, and you start the device and it contracts your pelvic floor, but using external stimulation. So actually there is some gluteal stimulation when you use these devices as well. And if you have if you have weak glutes, which very many of us do, or slippy glutes as I like to call them, we have a video on gluteal activation and on how to start to build some strength in your glutes. But if your glutes are an issue, then this is actually a really good product to try, because as well as working your pelvic floor, you also get a little bit of stimulation of your gluteal muscles. So that's it for today. I hope you found this information useful. Now I can...
There is one more video also, because there is different. There are few equipments. There are which is of different shapes and sizes. There is electrical stimulator will be of different shapes and sizes. Okay, so there are few more videos which I have already uploaded in LMS. So you can see about the electrical stimulator in that. Okay, so it is like it will be like a condom shape, it will be like a holder shape, like that. So whichever is beneficial to that particular patient, then you can choose that and you can ask them to buy and do it. So most of the time, if they are able to buy only the probe, that is more than enough, because only the probe need to be changed or need to be sterilized after each use. So you can ask the person to buy the probe at least, so that you will be able to give the treatment. Okay, so there is one more training that is called as bladder training, which is used for urinary incontinence. Okay, so it is not useful for stress incontinence. But anyways, I will be taking that in next class. Okay, so you have one more week, isn't it? So most probably by next week we will and most probably by 16th we will be completing everything, including the tutorials and including the tutorials. Is that clear? Are you all there?
Yes, miss.
Okay. Okay, so if you have any other doubt, then let me know. So before 16th, you just go through all the slides and you come out with your doubts and other things. Is that clear? Okay. Okay, thank you.
Thank you, Miss.